Hi everyone, and welcome to the very start of our webinar on supports for carers experiencing financial hardship. My name is Georgia. I'll be one of your facilitators for today. I'd like to start before we get into some of the content. I'd really like to start with an important acknowledgement of the traditional owners of the lands that we're all joining this meeting from. I'd like to pay my respect to elders past, present and emerging, and extend that respect to any Aboriginal and Torres Strait Islander people who are joining us today. I'm joining this call from the lands of the Wiradjuri Woiwurrung people of the Kulin Nation. I'd like to acknowledge that wherever in Victoria people might be dialing in from, this land always was and always will be Aboriginal land. Given that today is all about carers, I'd especially like to acknowledge the many thousands of years of care that Aboriginal and Torres Strait Islander people have given to the communities as well as the lands and waters of Australia. So thank you everyone who's joining today. We really appreciate you being here and coming to join us to talk about supports for carers experiencing financial hardship. As I mentioned, my name is Georgia. I'll be one of your facilitators, and I'll briefly pass the microphone over to my colleague Isabelle to introduce herself as
well. Hello everyone, and welcome to our webinar today. My name is Isabelle and I am in the care engagement team along with Georgia. Georgia will be facilitating today, so you won't see as much as me, but you might see me pop in with a little bit of timekeeping. But I want to welcome everyone today, and we really appreciate you taking time out of your day and out of your caring roles to come and listen to how our really amazing speakers can support carers who are experiencing financial hardship. So I'll pass back to you. Thanks, Georgia.
Thanks, Isabelle. So our speakers today are from a range of different organisations who they themselves provide support for carers experiencing financial hardship, or they work with carers and consumers in a range of areas that they might be experiencing some financial challenges. So we have from the Telecommunications Industry Ombudsman, Sean. We have from Good Shepherd, Romy. From the Energy and Water Ombudsman, Victoria, we have Mel. Not with us physically today, unfortunately she is unwell, but we do have a recording of Dermot from the Social Services Rights Victoria. And last but by no means least, we will have some speakers from Financial Counselling Victoria, including Bella and Susie. And we will also have a financial counsellor from the Consumer Action Law Centre, Kirsty, speaking with them. So just before we get into our speakers today, I'd like to tell you a little bit about Carer Gateway, the program that Isabelle and I work within, and are here today to tell you a little bit about. I'm just sharing my screen while we set up. So some of you may already know about Carer Gateway. You may have found out about this webinar from some of our communications, but we also know that some of you may not know much about Carer Gateway and what we do. So we wanted to start with a really quick overview of the supports and services Carer Gateway can provide. So to start off, we'd just like to really quickly talk about who carers are. It's not a term that some people use for themselves, so we know a lot of people don't identify as a carer. But our program uses the definition from the Carer Recognition Act of 2010, which is that a carer is someone who provides unpaid support to a family member, friend or partner with a disability, mental ill health, chronic health condition or age-related condition. Carers come from all areas of the community and all caring situations are very different. We also have a special focus in our program on young carers who are children and young adults aged 25 years and under. And it's important to know that 1 in 8 people in Australia are carers. So it's actually a lot larger community than many would assume. And there's certainly a lot more carers out there than are currently receiving supports in their caring role, which is where Carer Gateway can come in. So we'd also like to start with a little bit about why we're talking about financial hardship in relation to carers. According to some recent research from Carers Australia, up to 50% of primary carers are on a low income, and many of them have some difficulties covering living expenses, saving up money, or even covering some of the expenses related to that caring role. That same research has also found that by age 67, primary carers will lose on average, lose up to $394,000 in lifetime earnings, many of that in superannuation due to disrupted working. Despite these impacts on individual carers, the community provides a huge benefit to Australia as a whole. Australia's 2.8 million carers provide 2.2 billion hours of unpaid care per year, and the value of that unpaid care is estimated at $77.9 billion per year. So there's a really huge contribution that's being given to the communities by unpaid carers. So Carer Gateway, where myself and Isabelle are joining from, is the national program fund for carer services. We're funded by the Department of Social Services out of Canberra. And really the program exists to help any carer, no matter where they're living, access consistent and accessible services and supports for their caring role. The main ways people can get in touch with us are through our phone line, which is 1800 422 737, or via the website at www.carergateway.gov.au. We have a range of different services and programs that are available to support carers, including emergency and planned respite care, which is where somebody else might come and assist with taking care of that care recipient for a period of time, which can allow the carer to take a break. We also have counselling and coaching relating to the caring role and the goals that a carer may have, as well as peer support, which can help people connect with other carers in similar situations. We also have support planning programs and tailored support packages that can help carers in education and employment and in supports for their caring role. We also have a really fantastic amount of information, advice and online support available through the Carer Gateway website, including some supports about financial hardship programs that carers may have access to. To access Carer Gateway, the eligibility is actually really open. We like to pride ourselves on being quite an accessible service. The only things that we need is that somebody must be a family or friend carer. So that's an unpaid carer who's not in a formal employed role, and that the caring role is ongoing or likely to be ongoing for at least 6 months. Now that ongoing requirement is not intended to be a barrier. We know some experiences such as mental ill health or chronic health conditions can be difficult to predict. But it's really the difference between a short-term caring role where somebody will fully recover, such as supporting maybe a sibling who's broken their leg at footy practice, versus these ongoing caring roles that so many of our community take on. What's not required for our program is also really important. We don't have any citizenship, residence, or visa requirements. We can work with new migrants, refugees, international students. That's absolutely fine. We're also not means tested, so we don't look at a carer's finances and we don't look at your care recipient's finances either. We're also not affected by any other government supports, and we shouldn't affect any other supports that you may have in place, including things like NDIS packages, home care packages, or pensions. So that means that if you do reach out for support through Carer Gateway, you don't need to worry about how that may affect anything else that you're receiving. The only time we might look at some of those other programs is just making sure that the support we place is complementary to what other supports are in place for that carer or that family. Here in Victoria, Carer Gateway is delivered by a consortia, a group of health and community organisations across the state. Merri Health, where myself and Isabelle work, provides the statewide coordination for the program. So if you were to call up, you would first speak with our intake team at Merri Health before we put you in touch with a local provider in your region. Our local providers really know their area well. They've been doing this work with carers for a really long time, and they know exactly what the needs and what support programs are available in different communities. So you can see on the screen now, we have our Metro Melbourne partners, including Bendigo Health in Melton, Merri Health Carer Services in the West and North regions, and then Alfred Health and Uniting Vic Tas over in the East. And then in this screen here, we also have our regional partners across rural Victoria, including Ballarat Health, Barwon Health, Bendigo Health, Family Care, and Uniting Vic Tas. The important part of this is that no matter where you live in Victoria, you can call Carer Gateway on 1800 422 737, and we'll be able to help you with the navigation into any supports and services. Very quickly, I'll tell you a little bit about how to get in touch. We will be coming back to this slide at the end. So we have our 1800 number, as I've mentioned. 8 till 5, that goes straight through to our intake team. But that line is also active 24/7 for accessing emergency respite support. We also have a lot of information and support online, including a request a callback button. So again, that's 1-800-422-737 or www.carergateway.gov.au. Now, without any further ado, I will be able to pass on to really the stars of today's show, our support programs, our organisations who really deliver a lot of different services to support carers experiencing financial hardship. So our next speaker, I believe, is Romy from Good Shepherd. Romy, if you're able to get that screen sharing.
Unfortunately, I'm not, because it's telling me that host disabled participate screen sharing. Maybe I went through the wrong.
You should be able to now, Romy. Sorry about that.
Yeah, that's all right. And so I can. Very cool.
Excellent.
All right. Hi, my name, just while I'm sorting this out, my name is Romy Prince and I work at Good Shepherd. Good Shepherd Australia New Zealand is a not-for-profit organisation that helps people in vulnerable situations with a focus on families and on women. I would also like to start off by paying my respect to the traditional owners of the land and pay my respect to their elders past, present and emerging, and I appreciate that there are people from all over the country, so I pay respect to all of the traditional owners of the land. I know that this might be difficult for some of you to hear, but I want to just put some numbers to some of the things that you might already be feeling about, knowing that these figures go back to 2020, where it was expected that 2.8 million Australians will provide informal care. So that's around 10% of our population. And of those, around 906,000 will be primary carers and 1.9 million non-primary carers. And so you as carers are contributing around 2.2 billion hours of care in the year, and informal care has been valued at $77.9 billion in 2020. I know this may cause anguish when you realise that you're not receiving the support that you should be receiving, considering that you give so much to the country. But for those of you that sometimes feel bad about actually accepting something, just remember how much it is you're actually giving. So I am a financial capability worker. I work with people to help them develop their confidence, their knowledge, and their expertise in regards to money. And I have dealt with quite a few carers in quite a few different situations. I deal with carers who are caring for spouses, caring for parents, caring for children, whether they're biological children or foster children. And I've seen a whole lot of different reasons as to why there are financial difficulties for carers. A lot of it, some of it is to do with underemployment or unemployment. They've had to give up work to become a carer. This results in lower income or poverty. Sometimes there's illnesses and addictions and mental health issues arising in the carers. Because someone in the family has become sick or is sick, it often results in a significant change in lifestyle, and that often has some costs as well associated to care for someone needing support, whether it be physical adjustments to the house or extra support in terms of needing to pay for carers or OTs, speech therapists, and the list goes on. Sometimes some of the carers are unaware of some of the grants, concessions and discounts available to them, so I'm able to help with that. And also sometimes there's just a lack of confidence about money. Often people's lives change quite quickly, and all of a sudden you become responsible for money after many years of not being responsible for money, and you just don't have the confidence in being able to deal with money. So there's lots of different financial programs that provide support about money. And we're going to be hearing about financial counselling shortly. I'm a financial capability worker, so I am not a financial counsellor. Financial counsellors are able to do things that I'm not able to deal with. They do help people that are also in a lot more of a crisis situation than what I am. I am about dealing with people that are not in that state of crisis, about going through, and I'll go through an example shortly, about speaking to a participant, finding out what it is they need help with, and teaching them not only about information, but helping them develop skills and change behaviours so that they're able to be more confident about their money and also implement some changes as well. It's not financial education. I don't sit and just lecture the clients that come to me. I sit and I work with them, goal setting, looking at alternatives, developing budgets. I don't give financial advice like a financial planner will do. So I might work with a client and look at their banking structure, but I'll never advise them to go and buy one particular product. Then there are the financial hardship programs, I think will be touched as well by some of the other presenters today. And they're the programs that are offered by institutions, whether they be utility providers, banks, and so on. So who benefits from working with me as a financial capability worker? There are carers who want to build a longer term capacity to budget. They want to know how to manage their money better and also make more informed decisions about money. As I said, some of the clients I deal with are older women who are now responsible for finances for the first time. Sometimes single parents who are trying to raise children with disabilities and need to better understand what they're entitled to. And I've dealt with quite a few carers in the past, and some of the feedback I've received is that they identify that they've gained knowledge and being able to make positive changes because of the service, and they've already recommended the service. And also having the support, knowing that they were going in the right direction and needed a little supportive push. Often people don't have anyone else they can talk to about money. Money sometimes seems to be a bit of a taboo topic. Let me tell you about one of the clients that I saw. Let's call her Alice. Alice lost her sister to cancer, and they were both in their mid to late 30s. Alice took in her 2 orphaned nieces because that was her sister's dying wish, that the girls stay together and stay with family. The father of the girls was not in the picture. Alice and her husband were able to meet the costs of their family. They had a teenage son themselves, but all of a sudden, with 2 extra tweens in the house, one with special needs, they began to struggle to meet the rising cost of living. So Alice was referred to me as a financial capability worker, and together with Alice, we created a budget, and she was able to accomplish quite a bit in a short period of time. I got her to speak to a financial information officer through Centrelink, where she was able to learn about a pension she was eligible for. She spoke to a school to get extra support from the school in regards to uniforms and school books. We set up a second bank account. And so this is what I mean by talking about business, bank account structures. Money went into that bank account so that each fortnight, so that when the bills came up, there was money there in a separate account. And also she was able to have some money conversations with her son and her nieces, who started to sell not only their clothes, but some other things online, gave them money to go out and to buy some new clothes. I see people for a variety of different number of sessions. Sometimes it's just one, sometimes I work with someone for a few sessions, and I have some clients that just we have monthly meetings just to have catch-ups, just to talk about it. So let's take an example of a client who doesn't have enough money to pay their utility bills. So first of all, I make sure that they have the necessary knowledge they have. So who can assist them with their utility bills? If you haven't actually spoken to your utility company and you haven't told them that you're in hardship, they won't know. So they might send you to debt collectors because they don't know unless you tell them. That people might not know about the utility relief grant, which is going to be spoken about more by one of the other presenters. So providing them with some knowledge, they're making sure that you have the skills. Do you have the skills required to meet your own financial needs? Would you be able to ring up the financial hardship team? Do you have fluent enough English? You could possibly be dyslexic and not able to fill in the appropriate forms. So helping you develop some of those skills, and then making sure that you have the behaviour and have a look at what behaviours are stopping you from achieving what's necessary. Sometimes people are scared to ask for help or to speak to financial hardship teams. So those are some of the things that we deal with. So we have the program I work with is called the Commonwealth Financial Capability and Counselling Service. We're funded until middle of 2026. You have to be either receiving some sort of social security benefit, a newly arrived migrant or non-citizen, or a woman experiencing family violence. And we help to support people to build longer term capacity. I'm going to post that link in the chat when I'm finished. So you're able to go, and with those instructions, so you're able to go and see who the provider is in your particular area if you would like. And I'll also show you where you could find the link to the financial capability in case you are in the inner west or south or southeast of Melbourne, where you're able to provide our services as well. Please pop any questions you have into the chat, and hopefully we'll be able to get to them either at the end, or we'll be able to possibly send out the information to you afterwards.
Thank you so much, Romy. Really appreciate you sharing all that info. And I think a very helpful transition, you mentioning that if somebody hasn't let yet their utility company know that they're in financial hardship, then their utility company doesn't know that they can apply supports. That will lead us in very well to Melanie from the Energy and Water Ombudsman of Victoria.
A very nice segue. Thank you, Georgia.
No problem at all. Take it away.
All right. Okay, sorry, bear with me. And here we go. Okay, so hello everybody. I'm Melanie from the Energy and Water Ombudsman of Victoria. I'll just start very quickly with the traditional acknowledgement also. I acknowledge the traditional custodians of the land on which we meet and recognise their continuing connection to land, waters and culture. I pay my respects to elders past, present and emerging, and to those who may be listening today. Thanks for having me. So today I'll be talking about the kinds of supports that are available for carers with regards to their electricity, gas and water bills or accounts. So we resolve complaints about electricity, gas and water. We are an independent and impartial dispute resolution service, and we are free to use. We look at the facts and the individual circumstances of every complaint in order to make sure that a fair and reasonable decision is made, and as quickly as it possibly can be. We also provide advice and information to customers, and when it's appropriate, we refer customers to other support services if they want us to do so. So the types of complaints that come through to us most often are about billing issues. So they might be about a delayed bill or a catch-up bill because a customer's been receiving estimated bills, and then when the company's been able to actually perform a read, the account needs to be reconciled, and you might get a bill that's larger than you were expecting. Obviously, we're in winter at the moment, so we're seeing a lot of people contact us right now with bills that were higher than they were expecting, and they're struggling to pay for those. We also received lots of calls about billing mistakes. Perhaps your concession has dropped off your account, or you might be getting repeated bills, or perhaps your name is incorrect on the bill, things like that. So we address those as well. We can also help with any issues relating to connecting to gas, electricity and water services, and also transferring between companies or between providers. So, you may be with one provider and then you've decided, look, I can see perhaps that this other provider's got a better deal for me. I'd like to transfer. If anything goes wrong there or you have any issues there, we can certainly assist with helping you there. We do address complaints about meters, poles, wires and pipes. That's the infrastructure that supports, the electricity, gas and water networks. And of course, we look at outages and power surges. Okay, so cost of living pressures at the moment, it's a hot topic, and particularly in the energy field. We know that after 2 years of living in a global pandemic, that's had a really significant impact on Victorian families and their financial situation. This year, so as of sort of January, retailers restarted debt collection and disconnection, and this has really impacted a lot of families out there. So more recently, and you may be aware of this, it's basically in the news every day at the moment and has been for a couple of weeks now. Wholesale energy prices have begun to rise, and this has impacted the ability of smaller retailers to offer competitive prices moving forward. And what we expect to see is that the difference or the level of competition between the different retailers out there, we expect that to shrink and them to sort of even out a bit more. But again, we know prices are going up, and today is the 1st of July, so we're expecting lots of calls to come through in the coming months with people whose bills are going up. So, the cost of living pressures, they're going to, we expect them to drive financial or increase financial hardship for carers and their families, and potentially result in increases in household debt. So this is probably the most important part of our presentation today. So one of the things that you may not be aware of is there is a suite of entitlements called the Payment Difficulty Framework. And these entitlements under the Energy Retail Code mean that retailers and providers out there are obligated to offer customers different options if they're experiencing payment difficulty. So by law, electricity and gas companies have to offer assistance, and the level of assistance that they offer you is based on the amount that you might owe. So if you've got less than $55, and let's be frank, not many of us are getting a bill that's under $55 come through at the moment. So that's all of us. If you do owe less than $55 and you just want help to manage that amount, at a minimum, they need your provider or your retailer needs to give you more time to pay the bill. They can work out a plan to help you pay small amounts over regular instalments, or even an irregular payment arrangement. So maybe a bigger amount at the start and then pay off the rest a little bit later. And they need to provide the option for you to pay in advance. And this might be something like a centre pay arrangement, where you organise for your, maybe a pension to go straight through to the retailer, or you set up a regular sort of payment arrangement of small amounts that go towards your account, to ensure that you don't experience that bill shock. For those of us who have more than $55 owing, the company has to offer more tailored assistance. So that's specific to your situation and your needs. So they might, they can offer you a payment plan for you to pay what you're currently using, and then to repay any amount that may have built up over up to 2 years. They can also offer a payment plan where the amount that you do owe is just placed on hold for 6 months while you try and make, get on top of the situation again, and make reduced payments, and maybe address how much energy your household is actually using, and look for ways to try and bring that down. The other thing that your gas or electricity company must do is check that you are receiving any government concessions or grants that you are entitled to. We need to make sure that everyone is aware. These are things that you, as a customer, as a user of gas and electricity and water, these are things that you are entitled to. These are not things that can be offered. These are your entitlements. So they need to provide you with practical information on how to reduce your energy use. They can talk to you about payment options, as we mentioned before. And the other thing they really need to do is look at your current account and check to see whether that you're on the best deal that is available, or whether they might have another plan that's more suitable to your household and the energy and water that you use. And just to be clear, there is a suite of entitlements also associated with water accounts and that need to be provided by all the water companies throughout Victoria. So the utility relief grant is available to customers with temporary affordability issues, and it needs to be within the last sort of 12 months. And customers that might be at risk of disconnection or restriction, or maybe they're experiencing, some collection calls coming through from the retailer. Now, the utility relief grant is a maximum of $650 over a 2-year period. So the $650 can only be, you can request it once every 2 years. And it's for $650 for electricity, $650 for gas, and $650 for water. That's a significant amount of money. If your property only has one energy utility, so electricity, you're entitled to up to $1,300. And the ERG obviously is also available for water. So you do need to meet a certain criteria to be able to apply for ERGs, but essentially anyone that's experiencing affordability issues, be they, maybe a temporary situation, something that's happened more recently, or an ongoing issue, it's likely that you'll meet those criteria. The best way to find out is to contact your retailer, let them know that you're experiencing affordability issues or payment difficulty. You need to let them know, this information, and then they can talk to you about the utility relief grant. The great thing that came in October of 2020 is that it was made an ongoing requirement for electricity, gas and water companies to actually assist their customers with filling out those forms and then submitting them. And the reason why that's important is because, especially with carers, you've already got enough going on, and we want to make this process as easy as possible. So having the retailers or the owners moved from their customers to them to submit those forms has made it, much easier for people. So our complaint process, very, very similar to the TIO. What you need to do, I think the only difference is that because we understand and appreciate that electricity, gas and water are 3 things that you should expect to have a good uninterrupted supply of, and every Victorian has the right to be able to, to expect to have that. We want to make our process as simple as possible and as quick as possible. So we ask that you make at least one attempt to contact the provider, let them know what's going on, tell them what you need. If they fail to provide you with any of that assistance that I've mentioned already, if they don't give you clear advice, if they don't help you to, submit that ERGs form, then you can come to us. We don't need you to contact them again and again and again and try over and over. I understand how difficult and time consuming it can be to try and sit on the phone to your electricity retailer, for example. We don't need you to make multiple attempts, just one attempt. And ultimately, if you were to call your retailer and sit on the phone on hold for an hour, at that point we would say, you've made a reasonable attempt. You don't need to speak to them. You can still come straight through to us. And you can let us know, I've tried to speak to them, I failed to get through. We'll take your complaint. So our process is that we will refer the complaint back through to your provider, but it goes to a higher level, more senior team, a team of people that understand and have been trained in financial hardship matters. They've got lots of industry experience and knowledge, and you'll be speaking to someone, you know, who has the capacity to work with you towards resolving the complaint. The turnaround time, once we refer the complaint through to that more senior team, is they then need to call you, contact you at the time that you have nominated is most convenient for you. They need to do that within 3 business days. So it's very quick from the time that you call us to the time that you should be hearing from a higher level, more senior person at your provider. Hopefully you're able to work together towards a resolution, and, you know, again, we're in the very high 80s as well of the number of 80%, so in the high 80s of the number of complaints that are resolved, and that, you know, just through having a customer speak to a more senior person. But in those instances where complaints aren't able to be resolved, we would ask you just to let us know what's gone on, what was said, what did they offer you or didn't offer you, and we will then assign a conciliator from our office here to investigate and to work with both you and the provider to establish what's gone on and work towards a fair and reasonable outcome for you. We have a number of ways that you can contact us. Our call time is usually between 30 seconds and a minute. So we're right on top of that. You can call us on the 1-800 number on the screen there between 8:30 and 5, Monday to Friday. You can also email through a complaint to us, so you can take your time and do that at your convenience, maybe after hours. You can complete a web complaint form. The web complaint buttons, you know, register a complaint. It's on every single page of our website, so you can do it at any point as you're exploring the information there. We also have an online chat function so that you can, you know, if that's your preferred method, you don't have time to sit on the phone, but you would prefer just to type through some messages and ask some questions. We can register a complaint through that format as well. You can even come into our office and visit us here. We are in Melbourne Central Tower, so Melbourne Central Shopping Precinct. We're in the tower there at level 8, and that's at 360 Elizabeth Street. Or you can send us a complaint via post if you want to. Again, there's lots of really valuable information available on our website at www.ewov.com.au. Yeah, I would really encourage all the carers out there that are interested just to jump on and have a look at the information that is there. And I think you'll find it really valuable. And do consider contacting us if you require any support and if you're getting the assistance that you're looking for from your own retailer. We do provide help in other languages. You can request an interpreter as well, and the number is on the screen there, 131 450. If you want an interpreter, or you can just ask someone from our office when you contact us, and we'll patch one through. So thank you very, very much for your time today. I'll leave it there.
Thank you so much, Melanie. Really appreciate you going through that, and there certainly have been a couple of questions, I think, for you popping through in the chat. As we mentioned, our next speaker is from Social Security Rights Victoria. This is Dermot. Dermot's not here with us live, but we have a lovely recording from yesterday's session for you all. Thank you.
Hi everyone, I'm Dermot. I'm a lawyer with Social Security Rights Victoria. Today I'm going to be talking a little bit about how Centrelink, which is what we mainly deal with, can help carers and some of the pitfalls that can arise with Centrelink. I mean, that's what we deal with, the people that fall into the pitfalls. So I've got some information to try and help carers avoid those. I'll also be talking a little bit about SSRV generally, how you can get in touch with us and what services we offer. I will just quickly acknowledge the traditional owners of the lands on which we're meeting and acknowledge elders past, present and emerging. And for me, that's the Wurundjeri people of the Kulin Nation. There we go. Just make sure I didn't, yep. So first off, who is SSRV? So we are a community legal centre. So as I said, I'm a lawyer. We have a few other lawyers and a few other non-legal staff as well. We're statewide, so anyone in Victoria can access our services, and we specialise in social security law and policy. So what that essentially means is Centrelink, anything to do with Centrelink and social security payments, with a couple of exceptions, because Centrelink does a few other things. We don't handle Medicare, we don't handle child support, and even though it's not Centrelink, it's worth mentioning that we don't do anything in the NDIS space at this time. What do we do in terms of helping? We give information and legal advice to people that need it, and that includes secondary consultations for support workers, financial counsellors, other people working in the community services spaces. We do help people appeal Centrelink decisions. That's the primary thing we do as a legal service. Centrelink problems are legal problems, and so in some cases it can be beneficial to have a lawyer helping you out with that. So when we're talking about Centrelink decisions, we're talking about eligibility. In this case, it might be trying to access carer payment and there's been a rejection. Could be the DSP, that's a big one that we deal with, people getting knocked back for that, which is also relevant to carers because the people they're caring for may be on the disability support pension. And the other big one is Centrelink debts, which we'll talk a little bit about later on. We do provide support and training, and we're very grateful to be part of these kind of sessions where we can provide our information, and we also advocate for law reform. How to get in touch with us, I will reiterate this at the end, but we do have a legal assistance line for individuals. So if a carer needs assistance, they can call us on 9481 0355 and book an appointment with one of our lawyers. If you are a worker, so financial counsellor, someone supporting carers, whatever it may be, you have access to our worker helpline, which is on 9481 0655. That runs Monday to Friday. You can basically call up and, subject to the line already being busy, get a lawyer straight away who can help you with, a secondary consultation, take you through your client's issue, and point you in the right direction. So very quickly, I'm going to talk about the payments that are available to carers from Centrelink. What I'm hoping you can take away from this is basically checking that carers are getting everything that they might be eligible for. So the two big ones are carer payment and carer allowance. Carer payment is an income support payment. It's essentially a pension for people who are giving constant care to someone who has a disability, severe medical condition, or an adult who is frail aged. It is paid at the pension rate, and it has the same income and assets tests as any other pension. And it is an income support payment, recognising that many people who are caring can't afford time-wise to actually support themselves through work. And so this is where carer payment comes in. Carer allowance is a smaller payment. It's less than $150 a fortnight. It's essentially a supplement to help cover additional costs you may have if you're providing daily care to someone who, again, has a disability, medical condition, or is frail aged. That one doesn't have an assets test, and the income test is very generous. Off the top of my head, I think as long as you're not earning more than $250,000 a year, you can access carer allowance, provided you're providing the relevant care. You can get both carer payment and carer allowance at the same time, and many people do. The other ones that I've mentioned there, carer supplement and the child disability assistance payment, they are both supplements. You don't need to do anything to get those. If you are on the relevant payments on the 1st of July, so tomorrow, you will get those automatically paid. I'm just mentioning that because they are an additional top up that some people get. There is also carer adjustment payment, which is a one-off payment for people who are caring for a child who's had their severe medical condition or disability come around from a catastrophic event. So that could be something like a stroke, cancer, or a car accident. There's a few others that Centrelink list. It's for people who aren't getting carer payment. but they do need to be getting care allowance to get that, and it is a one-off to help them adjust to the new care situation that they're now providing. These payments are a lot more complex than what I've got on this slide. In the time that we've got today, we can't really go through everything. You could spend probably an hour and a half on these payments, but that's why I'd encourage anyone who wants to dive a little bit deeper to get in touch with us. The biggest pitfall that we see people fall into is not being aware of or not understanding or not meeting the Centrelink notification obligations. So basically, and this is, I have got some specific examples here for carers and carer payment, though it's important to note that if you're getting any Centrelink payment or your client is getting any Centrelink payment, the change of circumstances notification within 14 days applies. That's across Centrelink for everything. If you don't update Centrelink or the change in circumstances, there's a real possibility that you end up with an overpayment or a debt. Common changes in circumstances, particularly for carers, include changes to care arrangements. So including if the care receiver goes into formal care or is hospitalised, and I noticed that was mentioned in the chat already, that could change your eligibility for carer payment. Changes to living arrangements. So if someone moves, if you're living with the care receiver and you're no longer, like you move away from them, that could have implications for your eligibility. Changes to income and assets, and changes to relationship status. If in doubt, it is always better to update Centrelink than not. If you tell something that if you tell Centrelink something that they don't need to know, the worst case is they say, thanks, we don't care, and then they move on, and that's it. But if you don't tell them something they do need to know, you could receive more than you're entitled to, and that could result in an overpayment. Centrelink will tell you if they don't need to know it, so it's better to err on the side of caution. In terms of overpayments and debts, I do want to quickly talk about these. Again, this can be quite general with Centrelink. It's not just about carers, but it does come up. If you receive more than you're entitled to, Centrelink will raise a debt, and then they're then obligated to recover that overpayment. So recover the difference between what you received and what you should have received. Recovery can be negotiated with Centrelink. So you can put a payment plan in place, you can put other arrangements in place, you can even ask for a temporary hold. The idea there is that you can limit recovery to a regular payment that you're able to afford. It can be really helpful to speak to a financial counsellor about this. They may be able to do that for you, negotiate on your behalf. They can also help show what your financial position is, so that you can show, look, this is legitimately what I can afford, and set it at that affordable rate. Debt recovery may be waived if the overpayment was solely caused by a Centrelink error. So Centrelink stuffed this up and you had no idea that you were receiving the money incorrectly. Can also be waived. There's a discretion to waive it if there are special circumstances and you haven't knowingly misled Centrelink. As I say, Centrelink problems are legal problems. It's important to get advice about these waivers. It's also important to note that if your debt is a big one, if it's bigger than 10K, it could become a prosecution issue if Centrelink think there's been fraud there. So before you tell Centrelink anything or before you try and justify how the overpayments come about, get some advice to understand what the implications of that are and how to best approach it. And that's where we can come in. I've noted there that debts, like any other Centrelink decision, can be appealed. So very quickly, I just want to talk about review of Centrelink decisions. So there's a few different levels to reviewing decisions. The first is an internal review with an authorised review officer. For debts, there's no time limit. For cancellations or refusal decisions, there is a time limit of 13 weeks. You can appeal outside that time, but you may not get full back pay. In the case of you've had your payment cancelled, you may ask for payment pending review. In the case of a debt, you may ask for the debt recovery to be paused while the review is underway. If you're not happy with the authorised review officer, you can then go to the Administrative Appeals Tribunal, and there's two divisions. The first being the Social Security, they're going to change that, Social Services and Child Support Division. Same time limits as for an arrow, so debts, there's no time limit. For other decisions, there's 13 weeks from when you got the arrow decision. Centrelink isn't represented there. It's a free service. It's more like an interview than it is a hearing, but it is the tribunal and it is external. The final level is the Administrative Appeals Tribunal's General Division. There is a 28-day time limit for all kinds of reviews there, and that is a hard time limit, which is a bit different to the earlier levels. Still free, but Centrelink is normally represented by a lawyer, so it is much more formal, and there are conference processes in place. As I've already said, when we're talking about debts, the risks of appealing include that the debt goes up. I haven't already covered that. What I mean by that is if Centrelink look at the calculations again and discover, actually, sorry, the debt should have been higher, we've actually overpaid you more than we thought, they will increase that. There is also the risk of prosecution, and again, getting them to more closely look at a file, at your situation, may shed light on something they didn't see before, and then they send it off for prosecution. Also, anything that you tell Centrelink could be used in a prosecution. So there's a bit of a risk of self-incrimination. It's just like talking to the police, but that's why we're here to give you advice about that before talking to Centrelink. So that's a very quick overview of some of the payments that are available, some of the pitfalls, and where to get help. And just to reiterate, for workers who are mostly in this call today, please give us a call on the work helpline. We're available all day, every day, all week. And you can basically get a secondary consultation, talk through the issue, and if you want to make a referral as well, that's the best way to get in touch with us. For carers themselves, please give us a call on the legal assistance line. You can book in with one of our lawyers and they can take you through during an appointment for about an hour what the situation is. And if there are further services that we can offer, we can talk about that through those appointments. Thanks, Georgia.
Thank you so much to Dermot in absentia today. Really appreciate having that section here. There's a lot of really great resources there and a lot of questions coming through around Centrelink. Dermot's obviously not here to answer those live, but I do believe one of our other presenters may be able to speak to them in our Q&A section a little later. But our final and, but by no means, our last but very not least. There we are, sorry. Speakers today are from Financial Counselling Victoria. We're really excited to have them here, as well as one of us, their financial counsellors from the Consumer Action Law Centre. I will pass on over to you, Susie and Kirsty. Thank you so much.
Thank you so much. This is such an enjoyable session, and I just want to say before starting to go through what we have to present that please feel free to post whatever questions you think. The questions are very rich and they're very important questions, and we will be going through them after the session and in a couple of days' time, providing written answers to the questions, as well as some materials which I'm going to introduce now. We really I want us to have the opportunity to consider these great questions and answer them, though obviously we'll answer what we can on the hoof today as well. So please keep those questions coming. I think it's really important. I'm Susie Goldsmith, and my colleague Bella Walker. We both work at Financial Counselling Victoria, which is a peak body to which all financial counsellors in the state must belong in order to practice. And with me here today as well is Kirsty Robson, who's a financial counsellor at the National Debt Helpline, the component that's run by Consumer Action Law Centre. And that has a key role in the carer pathway, which I'm going to introduce. And being a financial counsellor, Kirsty can answer some of the more detailed questions, but as I say, we'll take some on notice and answer them in writing after the session as well. Now, what I want to do is just introduce to you briefly what financial counselling is and what financial counsellors are. Financial counsellors are skilled professionals. They have to meet certain criteria in order to operate, and it's a restricted term. So if someone says they're a financial counsellor, they should have a special number they can show you. And if you're ever concerned, you can always ring the peak body, Financial Counselling Victoria, and we'll check for you. But they're people who've done certain qualifications, they keep their learning up to date with us, they comply with various standards and ethical provisions, and they also, most importantly, have a credit licence exemption from ASIC, which means that they can provide the kinds of assistance that other people aren't entitled to provide, like with your consent, always calling the bank or that kind of thing. The service is always free, and it's not restricted on visa or any other grounds. It's always free. It's always confidential, independent and without conflict. A lot of work goes on in the peak body to check that people aren't secretly giving financial advice or benefiting in some way. And it's strengths-based. Financial counsellors provide options to you and help you understand your situation, but you make all the decisions. They don't take over. You guide what you're going to do next. And there's a bit more information on this link. You'll get the slides, so you'll be able to follow these links. What we've developed is a new online carer pathway exclusively for carers, which gives you access to financial counselling. We've tried to make it, the reason we've done this is really responding to some co-design work we've done with the Gateway and also with support for carers providers. And we found that we needed to make it easier for people to set up contact. We needed to respond to the thing that carers are busy, and it's hard sometimes to yet another number and yet another unscheduled callback. So we provide on the pathway, you can say which times you're unavailable so that you have a chance of not playing telephone tag. We try to give people some early assistance through this pathway, because the National Debt Helpline is a reasonably fast response. And then they can discuss, if they need longer term casework, they can discuss which agency they want to work with. The National Debt Helpline understands the different specialties or interests of particular agencies, and also the wait times. And sometimes carers have agencies they just don't want to go to. So we think that it's important there should be some choice. To use the carer pathway, you can go to this website, and as I say, you're going to get these slides, so you'll have all this. And you fill in the details, your own details at the pathway. And then once the requirements come in, you will get a call within a few days according to your specifications of and respecting your specifications of how you want to be contacted. And the financial counsellor that you speak to will listen to what you've got to say. And actually, when you fill in your details, you get a chance to put a few words in your own words about what your issues are. And if there's immediate assistance, or if they can give you information that you can use to help yourself, they'll do that. But if there's a need for further assistance, they'll help you make contact with the right kind of provider. We've made a little video to show you how to actually do the process in a physical sense, and the link, as I say, will be on the slide. So this is what it looks like when you go to the landing page, and I'll just keep going. And I'm just going to introduce Kirsty now to talk about some of what might happen, or some of how people can be assisted once they get in contact through the pathway. Kirsty?
Hi, Susie, thank you. So firstly, if you call up the National Debt Helpline, we can help those who have capacity to self-advocate. And then again, we can get you linked in with financial counsellors in your area. There's lots of agencies dotted around Victoria and Australia-wide who can do that advocacy on your behalf. So a few different scenarios, and we do have an enormous range that call the National Debt Helpline, but some we thought might be relevant. We had a client called Merri who called up with an $800 electricity bill in arrears. She'd been placed by her utility company on an unaffordable payment plan, and they told her that that was, the best that they could do, which was $100 a fortnight. They didn't offer the utility relief grant. They, breached the payment difficulty framework, where they didn't offer a payment plan which can go up to over 2 years. So, go through what Merri's rights are with her, talk about what an affordable payment plan would be for her. So looking at all of her expenses, and, discussing whether or not it's appropriate to make a complaint to the Ombudsman, or to go back to the utility provider in the first instance. And also you kind of work out what happened to make the arrears build up in that way. So whether or not she might need an energy audit, you know, if there's something else that has kind of occurred back when the debt started building, you know, there's always a kind of story behind that, and we can help get to the heart of the matter.
Oh, thank you, Kirsty. And there's just one other example we have to talk to today, but these are just examples. There are many things. Kirsty?
Anyway, so we get a lot of calls with people on pensions who have credit cards. And so Theo's had a credit card with one of the big four for decades. They've only been making minimum payments on the card and the debt isn't going anywhere. He owns his own home, but he's receiving a pension and his situation is not going to change. So because of his care recipients' medical expenses increasing, the card has, like, you know, suddenly become quite unaffordable and a bit of a burden, and he's worried about what will happen if he stops paying the card and is not able to meet those interest repayments. So we talked to Theo about requesting a waiver on compassionate grounds. You know, I've had many clients receive waivers on credit cards that they've had for decades. If you look at how much interest they've paid over the life of that credit card, I'm sure that they almost always have paid the debt down already, just in interest and fees. And discussing, you know, how to write a letter to send back to the creditor, outlining their situation and why it's just no longer feasible, and, you know, trying to protect that asset and get that card waived and leave the client in a much better position.
Thank you, Kirsty. Now I'll just run through a few resources, and we'll be really happy to participate in the Q&A at the end of this session. And as I say, if anything has come up in the chat or whatever, that we'll be answering it in writing as well. So there are other ways you can contact a financial counsellor. There's the National Debt Helpline, which is where Kirsty works. You can go to live chat there as well, and we've given those details there. And there's also some, you know, to find your local service, you can go to the government's Money Smart website, and you can go, it's actually more convenient to put list view. We're just updating that at the minute, but it will be pretty smicky in a couple of weeks. And we're you know, you can look for your local service, but equally the National Debt Helpline can point you that way. But the reason that we've set up the carer pathway is to make it that bit easier for carers. And also we're using this as a way of improving our response for carers as well, to sort of tune into carers' issues, understanding that carers take a sort of a disproportionate burden of these kinds of worries. And we want to learn more through this, and by highlighting the carer role, that helps us to learn more, liaise with other carer supports, and perhaps make things a bit easier over time. So we've got all these fact sheets, which I'm about to quickly show you, but this is the web page you go to if you go to download them online. But I'll just show you quickly. There's a fact sheet about how to refer yourself. If the care recipient, if the person you're caring for needs financial counselling, there's a fact sheet for you to share with them about getting that assistance. And we've got a little financial capability fact sheet, which just provides you with some information about the different programs, including the one that Romy was talking about earlier, the different programs that are available. And we've kind of grouped them according to whether the learning is one-on-one or, you know, which is more like the coaching that Romy was referring to, or whether it's a group thing or self-paced online resources. And then there's some DIY resources as well, some links to sites that are useful to know about.
Susie, just really quickly, I know you've got a touch more to do, but we will need to jump into our Q&A really quickly. So if you're happy to have one more minute.
We've just finished.
You're just done?
Yes.
That's all right. These are some really fantastic resources for people. So I think they'll be really helpful to share. We'll pop those through in the post-session debrief, we'll send out an email to everybody who's been registered. But yeah, as we mentioned, if you're able to put any questions for our panelists in the Q&A function, that's the easiest for us to navigate, and they need to be fairly specific questions. And of course, we cannot provide any specific and individual financial advice in this forum. But while some of our attendee sections might be coming in, we do have some questions that were given through the registration process that I'd love to sort of throw out to everybody here. One of the things that did come up a lot was some questions around superannuation, including how much individuals might be able to contribute and when and how super can be accessed early. I was wondering if maybe our financial counsellors or perhaps Good Shepherd might be able to provide some advice on who to speak to about superannuation specific questions.
So we can talk to people about accessing their superannuation on compassionate grounds or on hardship grounds. I will flag though that the legislation around accessing your super early is incredibly strict. And if you think that you're entitled, you might not be. Most people I speak to aren't able to access it. You have to be on Centrelink for 26 weeks consecutively, which means you can't miss a payment for any reason. Otherwise that starts all over again. And in terms of accessing it from the ATO on compassionate grounds, it really has to be the most extreme. The house has to be imminently being repossessed by the bank, or legal action is at that endpoint kind of examples. In terms of talking to someone for that kind of specific financial advice around contributing more to your super or how best to use your super to purchase a home, or how you can talk about your assets and super and your pension payments, financial counsellors do not give advice around that, and we don't give advice around which financial product is going to be best for you. We're not allowed to recommend any financial products. It's very strict, nor are we experts in that area. We talk to people about their debts and bills and being in financial hardship. The best place to go would be the Financial Information Service, where you can talk to a FIS officer, and you have to contact Centrelink, unfortunately, to get through to them, but they will be able to talk to you about that more future planning aspect.
But just to add to that, if Dermot was here, she would say that you also have to be aware when you contact Centrelink and speak to a FIS officer that's the information you share will be accessible to others at Centrelink. So you want information to be consistent with what you've said before. Dermot would want that, would want to alert you to that. But also, they also do some presentations and things online. So, you might be able to find out things in that area without actually needing to speak to someone individually. So that's worth tuning into.
I also wanted to add, sorry, Georgia, I saw a couple of things about credit reports and credit scores. If you have any issues with a default on your credit report that you think has been there, listed falsely or anything like that, call the National Debt Helpline and speak to a financial counsellor. There are lots of for-profit debt solution companies who charge an enormous amount of money and promise big things and very rarely come through. We call these guys debt vultures. I would not recommend that you pay a service to help you with your debt. They very rarely give you the best option. And there's financial counsellors that are free. So call the National Debt Helpline instead.
Or go through the carer pathway. Same thing.
Yes, thank you so much for that. There's a few questions coming through. I've just got one more from our pre-submitted. We obviously got a lot of questions around cost of living, as has been touched on particularly already, especially about utility or telecommunication bills. I just wanted to put a little call out to our speakers from EWOV and the TIO, just quickly to ask if there's any other programs that people might not know about that you'd like to briefly mention here if you haven't had. We know it's been a very short info session from you both.
Yeah, thanks, Georgia. I think certainly what I said before, most, in fact, all telcos should have a financial assistance program. So if at any stage you feel like there are going to be difficulties, you should always contact them first, because all of them should have a financial assistance program or a team that will be able to help you. If it comes to the case where they don't assist you, or if there's any issues, or you feel like you are not getting the help that you need, you come to us straight away. And that's probably very similar to EWOV as well. And we would be able to assist you then from that point. But the telcos are required to have that program and that assistance available to every single one of their consumers. So if that doesn't happen, and sometimes it doesn't, that's what we're there for, and that's when we can assist you to help you navigate through that.
Thank you, Sean. And Mel, do you have anything else you'd like to add?
Yeah, hi, Georgia. Yeah, I guess, look, some utility providers will offer a bill matching arrangement. So if you engage with them and you are able to offer to pay an amount, to encourage you to continue on this payment arrangement, they may offer to match that amount. So if you contribute this amount, they'll match it. You should always ask these questions. So if you contact your retailer, ask them if they're prepared to do a bill matching arrangement. And again, really, really important, do not, so don't end up paying or agreeing to a payment plan that you actually cannot afford. We hear from people every single day, and because, they were maybe afraid to speak up, they've agreed to a payment plan that they absolutely cannot sustain, and then 2 weeks down the track or a month down the track, that payment plan, they haven't been able to meet their payment arrangement, the payment plan is cancelled, and they're back at the start of the process. We will take complaints and arrange payment plans for as little as $10. So if you are struggling and you need assistance and your retailer or your water company is not providing that, please, please, please give us a call. We are here to help. We want to help. I understand that so many carers are really time poor. There's a range of different ways you can contact us. I would say the average call time from start to finish, once you get through to us in that 30 seconds to a minute, is probably about, if you let us know that you're time poor, you've maybe got the kids in the house or an appointment to go to, tell us. We will walk you through as quickly as we possibly can, and we can try and register that complaint and get it off to the higher level contact in, maybe 10 minutes or something. So just please get in touch with us if you need assistance.
Thanks so much, Melanie. And we probably have time for maybe one more question. And there's something actually that's, again, another one that came up, pre-submitted questions. I might throw to Romy from Good Shepherd. One person just asked, where do they even start? And I think there's been quite a bit of discussion today about people who are feeling really time poor and who maybe don't know what that first step should be. I was wondering, Romy, if you had any advice on what that might look like, or what you would share with a carer who's experiencing financial hardship but doesn't know where to start.
I would probably say to either reach out to myself or whoever the service is in your particular area, and we'll be able to do a quick intake and point you in the right direction, even if it means not working with us. If someone is in crisis, then I do send them through to a financial counsellor, or to speak to one of the ombudsmen as well, or else possibly speak to someone at Carers Gateways as well, and they might be able to point you in the right direction as well. Just remember, there are people that are out here to try to help. I know sometimes it's daunting and sometimes the answer isn't the right answer you want to receive, but at least give it a go.
Thanks so much, Romy. There's also just a few practical questions coming through about if people can get this session emailed to them. We will be sending through a recording of today's session, as well as some of the resources that you've heard about today, to anybody who was registered. So we'll be working on that over the next week or two and make sure that goes out to everybody who was registered. Before we wrap today, I will just really briefly go back to some of the contact information for Carer Gateway. If anybody is interested in reaching out, we do have not only the services that we provide, but we might be able to provide some referrals into all these other programs, including the Carer Pathway, to access financial counselling services. I will just share that information now for you all. If anybody is interested in contacting us, including if you have some feedback, if you've reached out to Gateway before, I can see in the chat that there are some people who have reached out and maybe would like to discuss what their experiences were. You can also reach out to us on that 1-800 number, that's 1-800-422-737, to share any feedback about your experiences as well. As we said at the start, 8 till 5 on weekdays, that goes straight through to our intake team. And then anytime, night or day, you can use that same number for access if there is an emergency. And once again, also encourage people to have a look at our Carer Gateway website at www.carergateway.gov.au. There's a lot of info there about things like some of these programs available, carer pensions and carer payments, for example, as well as some of the other supports that might be of interest. So I'll just briefly throw over to Isabelle, my co-host, who's been doing a lot of the chat monitoring and behind the scenes work. Isabelle, is there anything that you wanted to finish with? Anything I've forgotten to wrap up?
Thanks, Georgia. Thank you so much for facilitating. I'll just get my face up. Thanks so much for facilitating, Georgia, and just wanted to say thank you again to all our presenters. I hope this information is going to be really useful for the carers who attended today and all those who the recording will be sent to. So we really appreciate you taking time out of your schedules to share this information. And it was very informative, so I hope that other people felt the same. And thank you all for coming as well. We know that caring roles are incredibly busy and it can be a lot to juggle. So we appreciate you taking time to listen, and I hope that this is going to be really helpful. So I think that's all from me. Georgia, any final words before we wrap up?
I think that's wrapped it up well. Thank you everybody who's attended. Thank you for the really vibrant discussion in the chat, those who've shared their questions and those who've shared their experiences. I know that there's a lot of people who have been able to relate. And a big thank you also to all of our speakers today. Quickly, did anyone have anything they'd like to, from our speakers, anything they'd like to finish with before we wrap up?
Maybe very quickly, today is the 1st of July, so the $250 energy saving bonus is available to, it's not something that EWOV has anything to do with, this is a government grant of $250 to all Victorian households. I understand that website has crashed today, as you can imagine, everybody's applying. So, be patient, but don't forget to apply for your $250 energy saving bonus through the Energy Compare Victoria website.
Which is different to the $250 power bonus for people that had pensioner cards, which finished yesterday. So
correct.
You know what? So don't think I got it last week, I can't get this one. You can get both.
Yes, very good point, Romy. Excellent.
And if you're having any trouble applying online, you can call us and we can help you apply over the phone. Although I probably wouldn't recommend calling today. We're a bit inundated.
Yeah, it might be something to see how the website goes either later today or perhaps tomorrow. I'm sure that the tech people are well on their way working that one out. So thank you all. Definitely don't miss out on those power payments. And a big thank you once again to our speakers today and for the time yesterday as well. It's been a really fantastic session.